बिस्मिल्लाहिर्रहमानिर्रहीम इय्याका नअबुदु व इय्याका नस्तईन अल्लाहुम्मा सल्लि अला मुहम्मदिन व अला आलि मुहम्मदिन व बारिक सल्लल्लाहु अलैहि. Dear colleagues, I am Dr. Sultan Ayub, working as a radiologist. Uh, Today we are going to scan the normal anatomy of the urinary bladder. Here we can appreciate the urinary bladder. Whenever we want to scan the evaluate the urinary bladder, it should be adequately filled. Here we can appreciate this is adequately filled, and then it is scanned with the low frequency 3 to 5 megahertz probe, and it is examined in two planes. Number one is the transverse plane. As we can appreciate here, this is the transverse plane. I have put the probe in the pelvic region in a transverse direction. When we see in the transverse direction, we can appreciate the shape of the urinary bladder. This is almost rectangular shape when we put the probe at the pelvic region to evaluate the urinary bladder when it is adequately filled. So it is rectangular in shape, and when we at the same place we turn the probe at 90 degree in a sagittal plane with the pointer towards the patient head. When we do this maneuver, we can appreciate the shape of the urinary bladder. It is almost triangular in shape. So these are usually when we are going to scan the urinary bladder, these two planes are done, and the patient urinary bladder is evaluated. So when we have appreciated this urinary bladder in this plane, first I am going to tell you this is the muscular organ. The inner one, the layer of the urinary bladder from inner to outer, which are difficult to appreciate, is the mucosa, submucosa, then is the muscle layer. Muscle, which is the muscle? The dorsal muscle. And then is the adventitia or serosa. So, and then the inner one is the lumen, which when filled with the urine, it is anechoic. So this is the normal urinary bladder. It should be anechoic. There should be no internal echoes. The wall should be smooth, as we can appreciate here. And when it is anechoic, filled with fluid, no internal echoes, it will give, and it gives posterior acoustic enhancement. We can use it as a window to evaluate the pelvic organs. So when in this direction, when we have placed the probe in this direction, in transverse direction, we can appreciate this is the anterior portion, so we call it anterior wall, and this is the posterior portion, this is the posterior wall, and it has two walls. One is the lateral wall on the right side, we call it right lateral wall, and then is the left lateral wall. So this is the walls of the urinary bladder. Usually we can see easily when the bladder is fully distended or adequately filled. So what the function of the urinary bladder? It stores the urine. It stores the urine, and then release it, empty it during the detrusor contraction. When the this muscle detrusor is contracted, the sphincter, urethral sphincter should be relaxed. So when we put the probe in sagittal direction, we can see the urinary bladder in the triangular shape. So it adopts the triangular shape. So when we do such maneuver, then we can appreciate this whole surface. This is the dome of the diaphragm. This one from here to here is the dome of the diaphragm. We call it superior surface or dome of the diaphragm. And this region, which is a conical on the dome of the diaphragm, this is the apex of the urinary bladder. And usually here the urachal cyst, patent urachus attaches to this apex of the urinary bladder, then it extends toward the umbilicus. So this is the specific place, this apex, where we can see the urachal anomalies, patent urachus, urachal cyst, urachal sinus, and so on. So this is the main point we have to remember, and we should evaluate when we are facing such condition. So this is the dome of the diaphragm, and this, and then on this side, this is the now anterior surface, and this is the posterior surface. This one is the posterior surface. So this is the sagittal plane. When we do the sagittal plane, then what we do, we keep the probe and direct or tilt the probe, angle it downward toward the floor, or you can say toward the feet of the patient, so that we have such picture in which we can appreciate the prostate. When we appreciate the prostate, this area is the proximal urethra is communicating with this area. This is the neck of the, we can appreciate this is the proximal urethra, prostate, and communicating this proximal urethra with the neck of the urinary bladder. So in this way we can recognize the neck of the urinary bladder. And surrounding the neck, adjacent to the neck, is the base of the urinary bladder. What is the base of the urinary bladder? It is the posterior inferior surface of the urinary bladder. Posterior surface is separate surface, a wall. Posterior wall is the separate wall, while base is the, we call it the fundus also. So, or base of the urinary bladder. So this is the base of the urinary bladder, and this is the neck of the urinary bladder. Neck is the lowest part of the urinary bladder, and below this is the prostate lying below the neck of the urinary bladder. So what we have learned here in the sagittal plane, dome of the diaphragm, and apex, anterior surface, this one, this is the anterior surface, this one, this, and this is the posterior surface, and when we angle the probe, this is the neck, most inferior part, and adjacent to it is the base of the urinary bladder. So in this way we can easily see the prostate also, proximal urethra also, neck also, and the base of the urinary bladder, via tumor, some polypoidal masses, anything which is involving the base, we can see it, and we can report it that base is involved in the pathology. So now I am again going to scan it in the transfer direction. So when we again make the transfer direction, uh, it is a rectangular shape. And how we can measure the, okay, again I am one thing I am forgetting. I'm again, when we place the probe in this direction, we can appreciate the VUJ. This, here we can appreciate this smaller one. This is the ureter, and this is the vesico-ureteric junction, and in this way this is the vesico-ureteric junction. So this is the urethral orifice on the right side, this is on the left side. This is located at the posterolateral surface of the urinary bladder. This is the lateral surface and this is the posterior surface, and in this way ureter on either side continues into the and open into the urinary bladder. And this is the, and the area, this right and left VUJ, and the area between it from here to here is the trigone area of the urinary bladder. Trigone area is a conical in shape. So when we, I'm going to show you in rear, when we, this is the posterior surface, but when we move the probe, tilt the probe, angle the probe downward toward the feet, and this area between the two ureter or VUJ, and then here we cannot appreciate, and then the neck of the urinary bladder, this area is the trigone area. The whole area from here to here is the base of the urinary bladder. Base is located inferior to the posterior surface, posterior wall of the urinary bladder. Inferiorly it is located. So within the base is the trigone area between the two VUJ and the neck of the urinary bladder. This area is the trigone area, and this area where the ureter enters on the other side is the vesico-ureteric junction. So this was the anatomy of the urinary bladder, how we can trace the anterior wall, posterior wall, base, trigone area, neck, and the dome of the urinary bladder, and apex. So all these we have discussed now. Now I am going to tell you how we can measure the volume of the urinary bladder. First, put the probe in transverse direction, and then angle it at the same place. Angle it in the sagittal direction with the probe marker toward the patient head. When we have done such maneuver, then take the caliper, and from first we should take the AP diameter, which is the height of the urinary bladder. This is the AP diameter of the from inner to inner, and then make the transverse diameter inner to inner, which is the width, and then third is the length of the length, which is also the inner to inner diameter. In this way, we can calculate the volume of the urinary bladder in this patient. This is the almost 321 milliliter, we can appreciate what. This is the method how to calculate the volume of the ureter, and these measurements should be taken. So now I am again, I have done the, I have make the probe in transfer direction. So when we are going to examine the wall of the urinary bladder, we should zoom the image so that we can appreciate. Look here, this is the anterior wall of the urinary bladder. This is smooth, no irregularity is seen, and same should be on the all walls of the urinary bladder when they are when the urinary bladder is normal. So the wall, when it is adequately filled, it should be less than 3 millimeter, and when it is partially filled, it should be less than 5 millimeter. So when it is not adequately filled, the walls are seems to be thickened, although they are not thick, seems to be thickened. So the upper limit is when it is not filled adequately, partially or empty. Empty we can't appreciate, but if it is partially filled, it may go up to the 5 millimeter. That is the normal limit. So when it is descended or when it is adequately filled, it should be less than 3 millimeter wall measurement, and it should be less than 5 millimeter when it is not adequately filled, partially filled. So this was the wall thickness of the measurement. And then when we appreciate this, then we can see that what is the posterior to the urinary bladder. This is the posterior wall, and these structures are the seminal vesicles. And posterior to it is the rectum. This is the rectum of the urinary bladder. While inferior to the urinary bladder, if we move the probe downward toward the feet of the angle toward the feet of the urinary bladder, we can appreciate the prostate. So this is lying below the urinary bladder, connecting with the sorry, it is very close to the or inferior to the neck of the urinary bladder. So I have tilted the probe uh, toward the feet of the patient. We can here appreciate the proximal urethra, neck, and this on either side. Adjacent to this is the base of the urinary bladder, which contain the Trigone area. So this was all about the normal anatomy of the urinary bladder. So whenever I will come across the pathology of the urinary bladder, inshallah I will share you people so that we all can have we can have the information about all the pathologies regarding the urinary bladder. One thing I want to tell the some physiological points, because we know that there should be a coordinated control or coordination between the detrusal muscle. I can say the muscular control between should be regular and coordinated muscular control with the brain and spinal cord, because as we know that the brain and spinal cord, because we can voluntarily control the urine uh, until the brain or spinal cord are intact. So we can, and this needs the coordination, smooth coordination between the spinal cord, brain, and the muscle of the urinary bladder, retrosal muscle. Any dysregularities between the coordination can lead to the pathologies or within the urinary bladder. Means sometimes urogenic bladder we can appreciate. So this was all about the normal anatomy of the urinary bladder. So kindly, if you people like this video, share this video, your friends, your groups, your colleagues, and subscribe my YouTube channel. Press the bell icon so that other any notification which I upload should be conveyed to you people. Thank you very much. Wonderful. Now I have asked the patient to empty the urinary bladder. Here we can appreciate the empty urinary bladder. We can appreciate that still the urine is present within the urinary bladder. So we can here appreciate. Look here, we can appreciate that the wall of the urinary bladder are now more thick than when it was adequately filled. Here you can appreciate. So all around the wall are seem to be more thick than when it was adequately filled. So I can measure it. So here we can see that it is 3.9 millimeter. So when it is partially filled, we can appreciate that the wall seems to be thick. So this I want to show you that when it is not adequately filled, it is partially filled, and this is the when we are going to measure it. First, we measure the pre-well urinary volume. What would be, and when it is when we ask the patient to go for urination, then after complete urination, we should measure it uh, to calculate the post-wide urinary volume. So at that time it was 321 millimeters. So I'm going to measure it in two direction, in transverse direction and then in the sagittal direction from inner to inner. This is the height. This is the transverse diameter. Height is the AP diameter. And this is from superior to inferior is the length. And in this way we can measure the post-wear urinary volume. And it is, we can appreciate it is almost 29 millimeter. So less than 50 millimeter is considered normal in the young adult, and in the old it is almost urologist can better tell us. I think it is less than 70 millimeter in the old patient. So this fellow is having 28 millimeter after widening. So in this way we can measure. Whenever we measure the urinary pre-bed, and whenever we are going to evaluate the urinary bladder, we should also uh, measure the pre-bed and post-bed urinary volume. And also one thing I want to tell you, that when we are going to scan the urinary bladder, we should also see the ureter jet. We can wait. Look here, we can appreciate the jet of the for the color, and then we can appreciate the jet urinary jet through the ureteric orifice at the vesico-ureteric junction. Here we can appreciate this is also the method to see whether the obstruction is present or not present. So here we can appreciate this one is the ureter and this is the VUJ. Here ureter is entering posterolateral aspect of the urinary bladder. This is the posterior wall and this is the lateral wall, so posterolateral, and it take a oblique turn here due to which the reflux can be due to this turn, oblique turn, the flap wall mechanism act also, and the reflux which should not be in a normal patient is prevented here. So this look here, this is the urinary jet. So in this way we can measure and in between this urinary jet is the trigone area and the base of the urinary bladder. On this side is this. Thank you very much.